Imagine this. Your father, who you've known all your life, strong, invincible, suffers a heart attack, and your whole world comes crashing down, and you don't know what to do. He doesn't know what to do. This happened to me and to my family, to my dad, 10 times, until a doctor finally said, let's get you some help. We've been in and out of hospitals ever since that first heart attack. He's fine, he goes back to the hospital and then he gets well, but the underlying condition has never been addressed. So after he gets back from the hospital, he does his own thing again. Cigarettes, sodas, salt, over and over. I think the doctor is a guardian angel because he prescribed home health for my dad, and only then when we start seeing changes. Not only for him, but for my family, for us. We learned about the signs and symptoms of a heart attack. He learned to understand his symptoms. He knew his body. It's funny because he would say, I gained 2 pounds today. I need to stop drinking soda. I need to stop taking salt intakes. It's amazing, and it becomes a part of him. And eventually, because of a home health nurse who comes in every day to our house, monitoring his weight, he was very conscious now. And he was like, oh, my home health nurse is coming. I need to stop drinking soda. I need to stop taking salt in. And eventually he get his cigarette habit. Home health saved his life. Right now, he's a candidate for a heart transplant. How amazing that is. He is my life, my first love, and I can't imagine living this life without him. Home health saved his life. Home health works. And this is why we build AtHome. We employed the same clinicians that helped my dad. They are the management team. They are the ones that built all of our programs. One of the proudest program, I think, because I was involved in it and my dad was involved in it, is our CHF program, COPD program. We customized the CHF and COPD program for what would work and what would not work. And we got inputs from our patients, from my dad, what worked for him. And that is what we implemented to our CHF and COPD program. Home health works, and this is why we have AtHome. Because we want to reach out a lot of people, a lot of case managers, doctors, give them home health, refer them to home health. Home health works. It can save lives. It saved my dad.
We are a group of professional home health care providers that specialize in various fields of patient care, including therapy, nursing, social services, and personal care. Our focus here at AtHome Healthcare Team is to help our patients improve function, live with greater independence, and to stay home, avoiding further hospitalization. All of our nurses, therapists, home health aides, and medical social workers are certified and licensed to practice in the state of California. We employ the most caring, highly trained, certified professionals in the home health industry, and they uphold the very same principles of compassionate and competent care that our agency values. And we receive great reviews from our patients with regards to our exceptionally compassionate clinicians that took care of them.
AtHome Healthcare Team provides rehab program to where most of our clinicians are stroke specialists. They went through extensive training as practitioners, and we take pride using our evidence-based practice in order for our patients to become productive and effective member of our community. And also, we do a balance program to where we instruct our patients in the house to prevent fall and increase safety in order for them to live independence and quality good life and keep their pride being in the house to do their activities of daily living and be happy and be content to where they will stay the rest of their life.
I love working with at-home healthcare team because they're in alignment with my values as a nurse. They provide a lot of holistic healing and various modalities to what I call create a field of optimal healing for each patient, and getting to know each patient's goals individually, because everyone has different ideas of their health and wellness and healing than I might have for them. So deeply listening to the patient, understanding what they want for their health, for their wellness, and then using a variety of modalities to accomplish that. So with holistic healing, we look at their support systems, we look at their family systems, we look at nutrition and exercise. We also look at their spirituality, everything that encompasses the range of a patient's life. It needs to be encompassed with their healing. And I'm really passionate about this line of work, and the reason I became a nurse is to become an educator so that I can help to empower patients to take sovereignty over their bodies so that they can navigate the medical system empowered, not as a weak victim, but they know what their goals are and they're educated in everything, that every medication they take and every procedure that's being recommended to them as a patient.
What it means for me to work with the at-home healthcare team is that now I'm blessed to be able to work with such a dedicated team in order for us to provide excellent service to patients and their families. There's a ripple effect that we're able to provide excellent service for them so that they can get back to their prior level of function. I remain passionate about what I do because I'm surrounded about people who are passionate about what they do.
So what is transitional care to me? Transitional care to me is working with patients, following them with various challenges that they have. It's patients with chronic illnesses, and as well as them changing their healthcare needs with various symptoms and challenges, falls, you name it. So what I do is I work with various physicians from ortho, family practice, cardio, internal medicine. And what that does is actually gives me a relationship with the patients, because I'm able to follow them not only to the doctor's office, but also to the hospitals, post-acutes, skilled nursing facilities, boarding care homes, you name it. And then we have that relationship, and then what I'm able to do is help prevent them from being readmitted back into the hospital. So that's how I'm able to, really grow and build that relationship with the patient and help them with those transitional needs.
I'd like working with at-home healthcare team because they're professionals. They really know their craft, and they're become my friends. When they come, they treat you as a friend and not as a patient. Like we're family. My first encounter with home health was with Rads. I've known him from another PT, but the second time I got hurt, I asked for him, and I'm just so glad that that he's with a good group of people, that really could help me. It's like the other day I fell, and I called Jennifer and I called Rads, and they were there that day. I mean, that says a lot. I have been a patient of home health for so long. They've always helped me, whenever I need them, and they're good people, and they help me a lot, and that's how they impact, my life.